When's the right time to arrive at the hospital? In this video, I'm going to discuss the stages of labor and when you should make your way to the hospital, birthing center, or call your midwife if you're having a home birth. Hi, my name is Sade Dansil. I'm a dual qualified nurse and midwife here in the UK, discussing all things maternity so that you can have the best possible birth experience. Contrary to what they tell us in the movies, labor doesn't always start with your water breaking. The onset of labor usually begins with mild period-like cramping in the lower abdomen and back. At first, these pains will be irregular, lasting anywhere from 0 to 45 seconds. At this stage, your cervix will be dilating from 0 to 4 centimeters. Providing you don't have any concerns and baby is moving well, it's best to stay at home during this stage, as you're more likely to be comfortable in your own environment. A bath or a shower is always a good idea to help manage your pain, along with frequent mobilization and rest when you need it. In the active stage of labor, your cervix will dilate from 4 centimeters to 10 centimeters. At this stage, the contractions will become much stronger and more regular, lasting anywhere from 45 to 60 seconds. You should be feeling your contractions more regularly at this point, anywhere between 1 to 2 and 5 minutes. In addition, you may feel some pressure down below. Generally, during this phase, mums are quite uncomfortable. This is a good stage to call your midwife or healthcare professional and let them know that contractions are regular and painful. At this stage, they'll probably ask you to come in for a vaginal examination to see how far along you are. Remember, vaginal examinations are optional and you can decline. In the second stage of labor, your cervix dilates to 10 centimeters. At this point, baby is ready to come down the birth canal. At this stage, mums usually feel a lot of pressure down below and an uncontrollable urge to push. If it's your first baby, depending on the position of baby's head, your healthcare professional will offer you a vaginal examination. Depending on where the baby's head is in the birth canal, they may offer you an hour of descent for baby's head to come down a bit lower before you start pushing. Your body will tell you when it's time to push. It's important to listen to your body and listen to the healthcare professionals around you. In the third and final stage of labor, which is often forgotten, the placenta is delivered. Your body knows what to do and your uterus will start to contract back down to size. The placenta usually delivers within 5 to 30 minutes after the birth of the baby, but can sometimes take longer. After birth, your midwife or doctor will offer you a vaginal and rectal examination to make sure that there's no injury to the birth canal. And then it will finally be time for mummy and baby time. I hope this video was helpful. Let me know if there's any other topic areas you'd like me to discuss.